that there's been a tremendous hopefulness that walkability is going to be a solution to a number of health problems. And so it raises this question about how much walking actually happens both currently and how much it could happen after interventions. And one of the areas that turns out to be very hard to get right, even when you're starting with a greenfield from scratch, is to make walkable environments. People's obesity levels varied by county and by how sprawling those counties were, but exercise did not. And what they find is that heavier people were in these lower density, more sprawling areas. This gave a way of making an intervention where you could sort of engineer people to be skinnier. By creating these sort of higher density environments, you could make a difference in travel walking that might lead to a difference in obesity. I want to emphasize that these are both studies by very competent teams of the major researchers in the world that use cutting-edge methods and are exemplary. But what they do show is how complex the relations are between environments and health. Trying to analyze what kinds of both hard and soft infrastructure supports would lead to more walking and cycling. And what you can see is the community design, the overall layout is very important for transportation. The places where people do a lot of walking and cycling combine both hard and soft measures. When we're talking about walkability, what do we mean? For a lot of people, they mean that it's just a lively place. That looks like it's a walkable environment. There are a lot of people out walking. Sometimes it means infrastructure rich. For some people, it's just merely traversable, and that varies a lot by socioeconomic status and by kind of culture. So what's traversable to someone with a walker or with high-heeled shoes who is middle income and who can afford other modes of transportation is really different to someone who's low income. In general, there are sort of 4 things that people measure in research and practice to try and get at a picture of how much walking is happening in an environment. Sometimes they actually just look at behavior. Sometimes they actually are talking about preferences and perceptions. Do people think it's a walkable environment? Sometimes they're looking at environments. There's this dilemma in active transportation that people need monitoring and it isn't in place. Part of the problem with active transportation is the very local environment matters a lot. It's not like the motorized vehicle system where we have enough of those measures to actually sort of model a network. Very few places actually know how many sidewalks they have, particularly at a metropolitan level. It's actually out the front of my house, which has a walk score of 95. But what you probably can't see is it has the most terrible sidewalk, but you would have no hope if you're in a wheelchair of getting up and down that area. So walk score is sort of great for certain things and not for others. Walkability, though everyone kind of knows it when they see it, what they're seeing is different things. It's a very murky concept. There is just very little local data on this topic. It's really hard to do because of the sort of margins of error and the sample sizes and so on. And the easiest to measure items may have the fewest health links. So we have a dilemma in trying to measure health and environments.